As we heard, they're racialized communities disproportionately impacted by COVID-19, according to Statistics Canada. We want to continue this conversation with our panel. In Burlington, Ontario, Dr. Isaac Odame is a member of the Black Scientists Task Force on Vaccine Equity. And in Edmonton, we welcome back Dunia Nur, president of the African Canadian Civic Engagement Council. Thank you both for taking the time to be with us tonight.
Thank you.
Thanks.
Dr. Odame, I want to start with you just by getting your reaction to these numbers. I expect that they're not really a surprise to you. Toronto is one of the areas that was collecting race-based data around COVID early on, but now we're able to see these numbers across the country. What's your initial reaction when you hear these numbers?
Yes, the StatsCan data mirror what we found in Toronto, that mortality rates are 2 times higher among Black Torontonians, and they are 4 times more likely to be admitted to hospital or into intensive care unit. So it confirms the data that we have already identified in Toronto.
And Dunia, maybe I'll ask you, do we know what some of the factors are that contribute to this?
Yeah, we as well did a research last year through a partnership between the African Canadian Civic Engagement Council and Innovative Research. And we did do a national study to explore the impact of COVID-19 on Black Canadians. And we did find that it mirrors what Stats Canada is sharing with the public right now as well. And one of the factors that we found was Black Canadians are disproportionately impacted by COVID-19. For example, Black Canadians are more likely to report COVID-19 symptoms and either themselves or someone they know sought out treatment, and are 3 times more likely to report knowing someone who has died from the virus. Also, Black Canadians are more likely to report that their jobs pose them at risk because they typically work in front lines, face-to-face with people. Black Canadians also, the way that they commute to work. So they depend on, typically as a population, transit, buses, trains. There's also a lack of understanding when it comes to Black refugee communities, such as the story of Asli Farah that we shared, who's 52 years old, living in Edmonton, Alberta, a newcomer, ended up getting symptoms of COVID-19. And when she wanted to go get tested, she had to take 2 buses just to get to the testing facility. And that was with her, experiencing joint pains, excruciating fever, feeling drowsy, and then she took 2 buses back home.
And so, Doctor, hearing that, is that something that you echo as well, that this is not about the virus itself impacting Black bodies in a different way? Is it about the socioeconomics?
Absolutely. So the COVID pandemic did not create these inequities. They were there already. What the pandemic did is that it shed more light and in many ways accentuated these inequities. We do know that if you look at what we call the social determinants of health, that is non-medical social factors that impact or determine the outcomes of health, is dependent on conditions in which people are born, grow, live, work, age, and sometimes wider systems beyond their control that actually sort of control and determine how they live their daily lives. So this is the daily experience of racialized communities who are vulnerable and marginalized. We may want to think that the healthcare system works equally for everyone, but that is far from the truth. For example, writing a prescription for somebody with a chronic condition does not necessarily translate into being able to fill those prescriptions and be able to take the medication daily. So we know that Black people have poorer outcomes living with chronic conditions like diabetes, hypertension, heart disease, and the list goes on and on. So they have these underlying conditions that predispose them to severe COVID infections and associated mortality.
So, Dunia, these stats confirm something that advocates, community members have been calling for some time because they've been seeing it anecdotally, and there have been calls to take a targeted approach to dealing with these communities. Have you seen that? Has enough been done, or what more would you like to see?
That's a great question. I could confidently say enough has not been done. I don't even think that there's enough disaggregated studies, appropriate interventions, and the programs that is needed in terms of resource allocation, particularly for racialized communities, religious minorities, and the Black community. One thing that we did talk about is policy options. So in terms of short term, to provide testing sites in closer proximity to high-risk racialized communities who are having the highest level of COVID-19 and are dying from it. And long term, what we asked for is more research needs to be done. A lot of the things that we've done as a community in terms of anecdotal sharing the lived experience and the anecdotal stories, including the Stats Canada, including ASAC's research, that's just scratching the surface. I don't think a lot is known, or at least nothing is really being brought up to public awareness. Therefore, we need more research into marginalized community, including and definitely prioritizing the Black community. And this will ensure that better policy options are designed to help alleviate a lot of things.
Dr. Odame, I want to touch on something that our reporter Sarah mentioned, which is vaccine hesitancy. That stat, 77% of Black respondents, this was back in September, said they would not take a vaccine. Our hope is that, months later with more information that has changed. But we do understand that racialized communities, Black communities in particular, have a higher level of vaccine hesitancy. And knowing that Black people are more, disproportionately impacted by COVID, it's that much more vital for them to get and have access to a vaccine. Can you talk a little bit about where that hesitation comes from?
Yes, this is an issue of great concern, as you've outlined, that the population that is most at risk is the same population that is most hesitant about the vaccine. And this is based on both historical and contemporary experiences of mistrust with the system. So there are historical factors that is well publicized on the internet and on social media, where Blacks have been used for experimentation. There have been poor ethical standards in dealing with Blacks in medical research. Then there is a contemporary daily living experience that they experience with the system, that the healthcare system, although we all may think that it is available for all, we do know that access to healthcare is unequal, and also that people don't feel that they get the best out of the healthcare system. So all these areas of mistrust makes them hesitant because they think this way, that ordinarily we are marginalized, we are bottom of the pack. Now with vaccine rollout, we are being identified as a priority. So is this a form of experimentation? So it creates all these doubts and all these conspiracy theories. But we have solutions to this, because we do know that Blacks tend to trust information coming from messengers that come from their same racial or ethnic group. This is work that has been done in the United States. And there is also evidence that where there is a patient health provider concordance in race, you get better outcomes. So one of the ways in which we can tackle this is to make sure we choose the messengers that they trust. And these are the healthcare professionals within the Black community, community leaders, the social leaders within the Black communities that they respect and trust. And if we can partner with them and make them the messengers of the information about COVID vaccines, that they are safe, that they are efficacious, that they've actually been tested in clinical trials that included Blacks. In fact, in both the Pfizer and Moderna vaccine trials, 10% of the people enrolled in the trials were people of African descent. To reassure them that it's been well tested among Blacks, it works the same way, and it is safe for them to take.
All right, Dr. Isaac Odame in Burlington, Ontario, and Dunia Nur in Edmonton, thank you both for your time here on Canada Tonight.
Thank you.